I'm Chris Grayson at Ascend Perform, my gym. I want to make a quick video about gluten. I first heard about gluten in the early to mid 2000s, give or take probably 2005 roughly. More than likely I heard about it from Charles Poliquin or one of his connections like Dr. Johnny Bowden. And basically what gluten is, it's a protein found primarily in wheat, but it's also in barley and rye. And what happens is it can be problematic for our guts, whether it's the stomach or in the intestines, in the junctions of the gut that protect food from basically leaving the gut gets compromised, and food particles can basically get through the lining, and they're not supposed to do that. So when that happens, your body doesn't know what it is that is in the bloodstream now. It just knows that it's not supposed to be there. So it increases antibodies to deal with it, just like how your body would deal with a virus or bacteria or whatnot to fight it off. So when that happens, the body doesn't know the difference between gluten, which is a protein, and other proteins, for instance, perhaps collagen. And then what ends up happening is a lot of times the connective tissue deteriorates because the protein, like collagen, gets basically worn down because the body thinks it's gluten. So you get a lot of people with that are arthritic. That used to be kind of an old person's disease. Now we're seeing it younger and younger, with much younger people. And they're going to complain. The most common one is knee pain. You hear about knee pain a lot. And that can be food intolerances such as gluten or perhaps dairy. So I'm trying to think of what else. One thing I'd say about gluten is if you just go on Google and you search it, you're probably going to find stuff that's going to say that's a myth. Gluten safe. So you really have to make sure when you're looking up information that you have really good resources. One resource I would highly recommend is Dr. Perlmutter. He wrote a book called Brain Grain, and I would recommend having a resource like that and looking into it. I see this problem a lot at my gym, and I also do physical therapy as a physical therapy assistant, and people almost every time they come in with knee pain. And in my opinion, that a food intolerance test would be one of the first things I would do to rule that out. And I could almost guarantee you those people, it's going to come back that they have an intolerance to gluten. One interesting thing, I'm trying to make this video short, but it's kind of hard. There's a lab that Charles Poliquin used to talk about called Cyrex, and apparently this lab, if I did a food intolerance test and somebody else did, and we both had an intolerance to gluten. This is interesting. It might attack my thyroid and it might attack their joints. So they become arthritic or whatnot, and I just end up with like something like Hashimoto's, where I don't convert the active thyroid hormone T3 into T4. So different things somebody has a food intolerance to can affect people differently. But since this video is predominantly about gluten, gluten's probably one of the biggest, if not the biggest, food intolerance that people have. A lot of it's probably because we've genetically modified wheat. So you'll also hear people talk about how if they go over to Italy and they eat the bread or all the stuff that they would eat in America, they're fine. Yet they, a lot of times they even lose weight and they feel good. But over here in America, they eat those foods and, there's side effects and there's symptoms. And some say, again, that's because of, genetically modified foods. They're hybridized, or, maybe it's the stuff we spray on our crops and stuff like that. So that's it. I mean, it's been a pretty long video, and I was going to try to make this real short to a minute, but it's very hard to do. This is a big topic. Entire books are written on this topic. Very hard to keep it super short.